Hey team, how are we doing? Just so you understand, I'm going to record this. Time out, we're doing a right knee arthroscopy in a second.
I told you excedrin, she's allergic. 2 grams of Answer going in. 2 grams. Right knee is correct, and you all agree? Agree. Thank you.
So this patient, Tim, this is my PA, Tim Lopresty. Tim, this is the patient who we spoke about last week.
Correct.
Who called and said that she really needed help. She was in a lot of pain and she had a locked knee.
Correct.
And was begging us to help her.
Yeah.
Do you mind sharing what
Sure.
the call and what we did?
Yeah, I've treated her conservatively in the past. She has a known meniscus tear as well as some degenerative changes inside of the knee. We've tried some physical therapy. I think I may have given her a cortisone injection a couple months ago that she did well with. And then Friday morning stage, she had woken up. The knee felt locked. She couldn't move it. She said something snapped as she moved her knee. Felt like it broke off inside. And since then has had a terrible time. So I spoke to her Friday, and we were able to squeeze her in, really tried to rush everything along to get her in here to try and give her some relief, try to get some mobility back within her knee for her.
Right. And so I'm actually really proud of the fact that because we have an ambulatory surgery center, we were able to, in this case, accommodate her and help her to try to get her some relief. She was afraid to get out of bed, she told me, because of the fact that she had so much pain and such debilitation, because the knee felt locked. And so I spoke to her. I was able to get her some lab work. Now we're just looking inside the knee to see how damaged it is. And so here's a torn meniscus right there. There's a lot of inflammation and synovitis here. And this is one of those cases where even in this day and age now with COVID, we can and should continue to try to help these patients rather than just telling them nothing can be done. Spinal wheel, please. There we go, scalpel. Take that needle out for me, please. Thank you. Hey, can I get the blunt, please? Rainey, can I have the table down, please?
Sure.
Thank you, Shaver. Go ahead. Take that out for me.
All the way.
Thanks, sir. So the red here that we're looking at is inflammation called synovitis. That causes a lot of pain. This is a lot of cartilage damage that she has in the knee, unstable flap. All these kinds of things can cause pain and a locked knee. And in some patients, they can handle it and they do fine. Those are the ones that we're going to hold off on during coronavirus because, we want to try to avoid the surgeries for only those that are what we call non-elective, the ones where the patients really need to get them done. Thankfully, we're not in a hospital. Here's a meniscus tear. Thankfully, we're not in a hospital. A hospital is where the coronavirus lives. That's where it is, and that's where there's risk if we bring those orthopedic cases there. And I want to take this time also to applaud those colleagues of mine who are taking care of emergency surgeries and orthopedics, especially in the hospital. Everyone is at risk by doing that. We're just trying to do the best we can right now. Up biter, please. And so here is a flap of meniscus that we're going to trim away. Maybe a shaver, please. Okay, that's right. Here's a better look at it. There's a flap there, up biter. Tim, if we can get her a brace, that might be helpful, Okay. Shaver. Relax the knee for me. That's okay. My PA was asking me how the root is. This is the root. It looks stable. That's a good question. relax the knee now for me? Thank you. And now we're going to look and see if we can see the ACL. Shaver.
You got it.
Okay, stop. Let's go from the undersurface of the kneecap. Because we want to check everywhere, not just the areas that might think the pathology is located. So we'll go under the kneecap now. This is under the kneecap, under the patella, and the redness there is inflammation. Taking all that out, clean that up. Tim, I'd say grade 3 and even 4.
Yeah,
On the patella.
Yep.
Yep. Okay. Some loose fragments, but not that big. There's some loose bodies in here as well that are small that we're going to remove. Steph, can you show the screen? We're going to use the shaver to clean up and clean out any mechanical debris, those little flakes of white tissue that are floating around in the knee. Removing them makes the patient feel much, much better and is much less likely to lead to any more locking. Thanks, Tim. So now we'll close the wounds and set her up safely to come into the recovery room, let her recover, and I'll call the family who's waiting outside. We purposely want the patient's family outside waiting in the car to increase the safety. And let them know everything's well, and then after the patient's feeling well, we'll escort her back into the car and they'll go home. Then she follows up with us via telemedicine. We'll keep in touch with her, and she'll start physical therapy in 2 days, where the physical therapists are going to make sure that she gets her motion back, gets her pain better. I've also contacted the CEOs of all the physical therapy companies to make sure that they're going to stay safe, where there's enough social distancing between and among patients, and have their assurances that they'll stay open as well, which they will. A lot of them will. They want to take care of patients the way we do, so I'm very happy about the fact that we can continue doing this. Who knows how much longer the surgery centers are going to stay open currently. That's why I tried to get as many of those patients for the next week or two to come in and get this done in the hopes that we can continue to take care of those patients that need us. Thank you very much.